Health equity means people having the resources that they need to be able to lead healthy and fulfilled lives.
Despite women being over 50% of the global population and having health issues that uniquely impact women, less than 4% of global health research and development funding goes to women.
If you take a man and a woman in the same condition, with the same education, living in the same place, the woman is going to have more difficulties.
When you talk about modern medicine, it's probably 200 years or so. And most of that history has involved the study of men's health and men's disease.
We don't necessarily always have the tools, expertise, innovations, interventions, understanding of women's health and the consequences of poor care.
If we guarantee access to basic services, we enable a profound transformation in women's lives.
Generally speaking, governments tend to consider health as a cost and not as an investment.
$1 of investment in women's health means there's $3 returned into that economy, into that community.
Translated into 3.9 billion women who would have less early death, less health conditions and disability, and stay productive in the workplace.
The drivers and consequences of health inequity are multi-sectoral and they're multifaceted. And so naturally the solutions will need to be as well.
The Global Alliance for Women's Health is looking at closing the women's health gap. We address conditions that affect women only, conditions that affect women differently, and conditions that affect women disproportionately.
The Global Alliance on Women's Health is a very good way to increase awareness around the situation, not only in the population, general public, but among the medical profession.
The Alliance has a capacity to put together people from different places who have different perspectives, different positions, different interests too, coming from different cultures.
It's one thing to talk about it. It's one thing to have a conversation about health equity or gender equality and the impact it'll have. It's another to say, here are some big bets we could make, or here are some opportunities.
We need women to be at the table. For women to be at the table, they need to be healthy. Conversation breeds the opportunity to be able to make progress on these issues.
Investing in women's health is one of the best investments a society will ever make. And that's why we have to make decision makers, leaders, ministers of finance, aware of the opportunities for their societies by investing in the health of women.
It's not just about women, it's about everyone.